Hi, everybody, and welcome to WTF Health. What's the future of health? We are talking to the who's who of health technology and healthcare innovation. And what conversation would be complete without going into one of what I think is going to be one of the hottest trending areas in health tech next year. So we are going to talk today about obesity and obesity management. And joining us as our special guest is Dr. Greg Steinberg. He is the former head of clinical innovation at Aetna, left Aetna about 4 years ago, but we're going to pick his brain because he's got a great perspective on the employer and payer perspective when it comes to weight management and weight loss solutions as part of some of the work that he did at Aetna. So we'll dig into that, but before we do, Dr. Greg, it's a pleasure to have you with us today. Thank you so much.
Nice to be here.
Good. I'm glad to have you here. All right, so I want to jump in on this because something struck me within this health tech world. I follow the space very closely, and about July, right? So a couple months into this pandemic, all of a sudden I see something, well, from your former company, or at least part of it. CVS Caremark releases the new class of their digital health point solutions, the digital health solutions that are in their new formulary. And of the 5 new ones, 4 of them are focused on weight loss. And all of a sudden I start thinking, uh-oh, what does CVS know that we don't know? So I'm curious to talk to you about kind of the employer, the payer space, and the fraught relationship that they have had with weight loss, weight management type of solutions, because this is really, it sits in a weird spot between wellness and in health. So let's start there. I'd love to pick your brain. Do you think we're classifying some of these digital health solutions correctly when it comes to how they help tackle obesity, which is often an underlying condition for a lot of things? It has a huge impact on COVID-19. What are your thoughts on the way that we're addressing, the obesity epidemic that's been around us with different types of point solutions, as it may be?
Well, I think there's a couple of things. First of all, unfortunately, there are not a lot of solutions out there that have been demonstrated to be effective, at least in the long term, with respect to weight loss. I mean, that should be called out first. That said, it is, I think, being increasingly recognized as time goes on that, as you say, obesity is a risk factor in and of itself, but it also carries a lot of other baggage with it, such that a lot of other comorbidities are affected in a bad way in terms of clinical events and costs. And back to the payers, I think that is that increasing realization on their part that obesity is a huge cost driver, adverse cost driver, that it is making them want to rethink their emphasis on weight management.
As far as that rethinking goes, I mean, I'd love to pick your brain about what you think, some of the hallmarks of a good obesity management or a good weight loss solution are. Like, what is somebody like with your background? I mean, you were, like I said, head of clinical innovation at Aetna. I mean, you were involved in a study with a company called Utopia, which takes an interesting approach. They've got like a genetic test that they do. They try to focus on different aspects of weight loss. I mean, so what have you learned about what makes a good solution in terms of something that's both appealing to people who want to use it, like engagement, and also for payers and employers who want to pay for it and feel like they're getting their money's worth out of it?
Right. So I think, first of all, from the perspective of the solution itself, I think it needs to be something that resonates with the user in a way that they believe makes it personal to them, which is why, for example, you mentioned the genetic component of the Utopia solution, which is voluntary, by the way, but to the extent people use it, it is going to give them a snapshot of their own inherent genetic predisposition towards certain behavioral aspects related to obesity. And in a sense that demystifies certain things, it also takes some of the blame out of it from the perspective of the person, which makes it more personalized to them and more acceptable to them. So a solution that, as I said, is personalized, I think is felt to be personalized, is key to the answer. The second part, though, is no matter what the solution is, you need to, in a way that is relatively bulletproof, prove that it works. And that means ideally doing a controlled trial, which avoids all the issue about selection bias that many of the so-called studies are inherently guilty of. But if you can do a true controlled trial that has what I would like to call a plausibility chain, meaning you have the intervention, you show that it reduces weight in the group that is randomized to the intervention as opposed to the controls. You also show that clinical events in those people are reduced. And last but not least, you show that costs are reduced. If you can demonstrate that clearly and publish it, then you've got a winner.
Okay. Is there any part of that that's more important than the others when it comes to the employer and health plan perspective? I mean, because I think that they have a reputation, obviously, of being mostly focused on the cost of it. And this is where it's like, for me, it's like I do a lot of work, with a lot of different digital health companies, and they run the gamut, some of these. I mean, some of them are very focused on, the traditional, maybe a cognitive behavioral approach. Some of them are focused on, on integrating, different devices in, or integrating exercise programs in, or they're coming at this from a lot of different ways. And I think that
Right.
as a result of that, like we had talked about initially, is this a wellness solution or is this like a healthcare solution? And there's a different appetite in terms of reimbursement around both of those things. So when you talk about what makes for a good solution, I mean, how important is that ROI, especially when people want to see, immediate impact on the bottom line, and maybe cost savings isn't enough? I mean, talk to me about that. I mean, you were in your role at Aetna,
Right.
how much of the decision making was that cost piece, and
Right.
what's better, that cost avoidance or showing the ROI on the bottom line?
Well, I think it obviously depends on who is answering that question, right? I mean, at the end of the day. But I think, first of all, it turns out that doing cost analyses can be quite tricky and noisy. And in other words, what you see is not always sort of clearly, it is not clear what you're actually looking at. Utilization is, in a sense, easier to understand, and clinical events are easier to understand. I'm going up the chain, if you will. So because you go at the far end, you have costs, then you have utilization, then you have clinical events, then you have what we call surrogate markers, like blood pressure change and blood sugar change and things like that. And what the more enlightened payers are looking at is they will accept, again, if you can demonstrate a plausibility chain relative to your intervention. And the chain is actually also, it's a temporal chain. So it's sequential. You put the intervention, the first things that'll change are their biometrics. The next thing that will change are perhaps your clinical events and utilization. And the last thing that changes is your costs, because the claims run out and all of that. So there are enlightened payers, shall we call them, that are willing to accept a result that is further up the chain and comes quicker as a reasonable surrogate for true cost savings or cost avoidance. Because there's a lot of literature, for example, that says if your hospitalizations go down by X, either X percent or X absolute number, that's worth a certain amount of dollars to that payer. They know what that number is. You don't have to wait for the dollar results to come in for them to accept that. So I think if there is a way to, again, demonstrate clearly and ideally in a controlled way that an intervention has a beneficial effect on biometrics and utilization in clinical events, even without getting full cost data, you're going to get a lot of people accept that that's true.
How do you think COVID is going to change the conversation around obesity and weight management in health plans and employers? I mean, we know it's a risk factor. We also know it's a joke, but it's not funny. I mean, like the quarantine 15 is a real thing, the COVID-20, I mean, so people are looking at, losing weight, not only to protect themselves against some adverse effects the
Right.
disease, but also, because we've been sedentary and stuck at home. So how do you think COVID is going to shift this conversation among those big health plans, among the employer groups moving forward into 2021?
Well, I think they're going, because it turns out it not only, as most people now clearly understand, not only is obesity a risk factor for having bad outcomes with COVID, it is also apparent now that it actually increases your likelihood of getting COVID in the first place. That there's probably something going on with your immune system as a result of being overweight that makes it more likely for you to get the disease in the first place. Bottom line is, if you're a payer and responsible for the costs incurred, it is a sort of business imperative now almost for you to try to do something that will improve the outcome of your patients, of your employees when they get COVID, if they get COVID, and reduce the likelihood of them getting it in the first place. So, it's a convergence of the right thing being done, maybe not for the right reasons, but the right thing will still nonetheless be done. It is an increasingly important target.
Do you think moving forward, this will shift the way that, even beyond COVID? So, as we move past this pandemic and as we get on the other side of it, as a vaccine is developed, do you think that this will have a lasting impact on the way that the industry views, weight loss and weight management type solutions? I feel like the last couple of years in particular, I feel like I've talked to so many different people about chronic condition management. And we all know that chronic conditions, a lot of them are tied to being overweight or being obese. We know there's been an obesity epidemic for the last 20 years. I had to Google, I'm like, how long ago did this start? But it's been a problem in the States in particular for a really long time. But it seems like it's never really gotten enough attention, from the healthcare establishment, so to speak. Do you think that
Yeah,
now,
well, I think it's
COVID, the
because,
conversation has changed?
yeah, my sense is partly because part of the problem has been that weight management has been pigeonholed into essentially a wellness space, as opposed, which is fine, but it's understating the potential utility of an approach of weight management. Weight management, it could be argued, is even more important, assuming it works, when it's pointed to people who are actually at some point in the continuum of the disease spectrum. They are the ones who have the most to gain, both clinically and cost-wise, from a successful weight management program, as opposed to somebody who is otherwise completely healthy, but for the fact that they're overweight. And so I think that's part of the problem historically. People have been looking at weight management only for people who are relatively well. Turns out that making them healthier is hard because they are already pretty healthy by definition to start out with, and therefore finding an ROI is almost impossible. And that's led to some disappointment and disillusionment over time. But it's in a sense, I think they've been looking in a sense at the wrong population. I'm not saying don't apply weight management to people that are otherwise healthy. I'm saying, in addition, and maybe even as your first priority, apply weight management to people who are ill. That's where you're going to get the most bang for your buck.
I think we're seeing that, in a couple of different ways. We're seeing a lot of different digital health solutions kind of integrate that in. Is there a secret sauce as far as you're concerned about the best way to do this, so that if you are somebody who does have a disease, and on top of everything else that you have to deal with your disease, the physical symptoms that you may have from it, the mental health impact that it might have on you, now you've got to lose weight too on top of this, it's one more thing, right? But is there a way to do this where it does, in your opinion, where it is doable and it is something that is achievable by the person on the other end of it?
Yeah, so I think there's two things. One is, we talked about before, is I think for weight management, it's just hard, all right? And all of us to some extent have sort of lived that personally ourselves, and it's hard. And so, the first thing is to find a solution that works for you, whatever that means. And it's different for me than it is for you, than it is for the next guy. So you need to have a solution that's flexible enough to account, identify those differences and be flexible enough to account for all those differences. The second part, which is hard and I don't think is being done, at least to my knowledge, is, like you say, a lot of, particularly if you turn weight management where I think it should go, point it to the people that are sick. They have other things going on, and including mental health issues. There is no good solution. The ideal solution is one that would be holistic, that would actually say, look, we know that you have this, this, and this, and this. And as opposed to, we're having disease management company X look after your diabetes, disease management company Y look after your blood pressure, and some other weight management company look after your weight, and nobody talks to each other. That's irritating. Time, it wastes time and money, and it's stupid. So what you really need is ideally a holistic solution that does it all.
Do you think we're moving toward that?
Say that again?
Do you think we're moving towards that? I mean, I feel like there's I can think of a handful of different health tech companies that are focused on the chronic condition management space that have started to build these integrated platforms.
Yes. I think
Omada, OneDrop. I mean, there's a number of them that have started to build these integrated platforms that tackle all of that. Utopia is one of them. There's like a variety. Vita, Verta. I mean, you name it.
Right, and I think that, and that's good news. I think that their ability to do it successfully is really the key question, and time will tell. And again, these are measurable things. So, again, successful solutions need to prove that they're successful.
You just said measurable again, which leads me to want to ask you, that's where I pointed my little finger at you. Does this make it easier for a payer to swallow as something that is a reimbursable type of expense? When you have that more platformed approach, it is integrated into that disease management space as opposed to the wellness space, like you said. Takes it out of that bucket where it's been miscategorized. Does this make it easier for a payer?
I think it does, because again, there's more juice to squeeze. These are people who cost more by definition, and it is easier therefore to show a relatively small percentage change in their cost structure is easier to demonstrate, because there's more stuff there, if you will, more dollars.
Mm-hmm. As we move forward into 2021, last question for you, just to get your thoughts. You're watching this space. You've been involved in a very long time. I mean, and what's funny is I feel like there's so much of a cyclical nature to what's trending in healthcare. But here we are in unprecedented times of this COVID-19 pandemic. What are your thoughts for 21 moving forward? Like, what do you think has changed that will not go back? In terms of either, I mean, and feel free to go more broadly if you'd like to add to this, weight loss conversation that we've been talking about. But I would be curious to hear, if you think the conversation has changed in such a way, or if you think that the way that payers are going to be approaching population health, how do you think that's going to be different as a result of, what we've been through this past year, and as we look to the way that plans are going to have to change to, deal with some of those hidden healthcare expenses that were not realized in 2020 as they're trying to deal with them in 2021. I mean, what do you predict for what's ahead?
Well, I think that the COVID epidemic, leaving aside, the work at home stuff and all of that, but relative to the health aspects of it, I think what the COVID epidemic is really highlighting is that there needs to be an increased emphasis on holistic, measurably good solutions for relative to weight loss or weight management and mental health. Because those are two, I think, of the big areas that have been highlighted, as far as I see it, as real problems that basically they've always been there. But when you have a plague like COVID, it just basically pours gasoline on that fire. The fire was always there, but everyone can see it and everyone can feel it, and it's feeling it themselves, feeling it in those that they love, and the payers are noticing it too. So short answer, I think it's going to accelerate the already existing trend towards trying to identify successful weight loss solutions and successful mental health solutions that are digital, if you will.
Okay. I have the same feeling. So I'm gonna let you leave it there, because I think as we move forward, especially into next year, we're gonna start looking at the everyday mischief that we can get up to in our homes with a little bit more of a judicious eye, and start tackling those solutions day by day as before they become really big issues. Dr. Greg Steinberg, thank you so much for your time today. It's a pleasure to speak with you about this. I appreciate you weighing in on this. I do feel like it is a trend, and I think that this is not going to be the first or the last conversation that or I shouldn't say the first. It is the first conversation, not the last conversation that I'll be having about this moving forward. So thank you so much for your time and sharing your experience from all those years at Aetna behind those walls. Great to pick your brain. I'm Jessica DaMassa. Thank you so much for joining us here on WTF Health. If you'd like to catch more interviews with those who are changing the way that we will experience the future of health, please check out my YouTube channel. It is youtube.com/WTF Health. We'll talk to you guys real soon. Take care.